Hi there. My name is Dr. Jefferson. I am an ADHD specialist in ADHDsymptoms.com. A mental disorder is a behavioral or mental pattern that causes considerable suffering or impairs personal functioning. It is also known as mental sickness or psychiatric problem. These symptoms might be persistent, relapsing, and remitting, or they can occur in isolated instances. Many ailments have been identified with signs and symptoms that differ greatly among them. A mental health expert, usually a clinical psychologist or psychiatrist, can diagnose such conditions. The causes of mental illnesses are frequently unknown. Findings from a variety of domains may be incorporated into theories. A person's behavior, feelings, perceptions, and thoughts are commonly used to define mental disorders. This is generally linked to specific brain regions or processes and occurs in a social setting. One element of mental health is a mental disorder. When developing a diagnosis, cultural and religious views, as well as societal conventions, should be considered. Mental health specialists such as psychiatrists, psychologists, psychiatric nurses, and clinical social workers conduct evaluations in psychiatric institutions or in the community, utilizing diverse methods such as psychometric testing, but often depending on observation and questioning. Various mental health experts provide treatment. Two important treatment options are psychotherapy and psychiatric medication. Lifestyle adjustments, social interventions, peer support, and self-help are some of the other treatments available. In a small number of cases, involuntary detention or treatment may be necessary. Depression has been demonstrated to be reduced via prevention measures. Is your child's condition attention deficit hyperactivity disorder, or simply a case of kids being kids if he's always in trouble at school and won't quiet down? According to new studies, there could be a third, somewhat unexpected, perpetrator. David Granite, Ph.D., is the director of pediatric ophthalmology at the Children's Hospital of Philadelphia. The University of California San Diego's Shiley Eye Center reviewed the case. Records of 1,700 children with ADHD were examined, and it was determined that of the 1,700 children diagnosed with ADHD, 16% of those who had their eyes examined had convergence insufficiency, which is an eye condition. A state of disarray that makes it difficult to focus on adjacent targets. People who have reading can be difficult for those with this disease. The research, which was presented during an American Academy of Pediatric Ophthalmology and Strabismus meeting recently conference, children with ADHD are 3 times more likely than children without ADHD. Convergence insufficiency is more common in some children than in others. This is concerning because doctors frequently screen for ADHD by asking patients to complete a questionnaire, assessing reading concentration, indicating the possibility of misdiagnosis. Granite believes that something in the brain is causing the problem. It occurs as both ADHD and an eye disorder, or it manifests as both ADHD and an eye disorder, that the disease may be to blame for the symptoms we call ADHD. But parents should not be discouraged. Convergence insufficiency is a problem that can be solved. Simple eye exercises can be done at home. Granite remarks, "I have convergence insufficiency. Neither of them, these diagnoses imply that you will be unable to continue living a fulfilling life, a fruitful career." For more information about this topic, please make an appointment online at ADHDsymptoms.com. All you need is a smartphone, computer, or tablet. A medical doctor will see you from the comfort of your home. Thank you and have a great day.